While the social isolation measures are imperative for our health at the moment, they could inadvertently have some really negative impacts on a range of situations. To discuss her concerns over this, I have Linda Burney, the opposition spokesperson for Families, Social Services and Preventing Family Violence. Good afternoon.
Good afternoon, Fiona.
You are concerned that this prolonged self-isolation could be dangerous in situations where there is violence in the home.
Well, it's very demonstrated, particularly from overseas examples, and also for what we're hearing across the sector, that it is dangerous. I mean, we knew what a problem domestic violence was before coronavirus, and then you add on top of that increased sales of alcohol, you add on top of that worries about money, job security, and being living in conditions where you can't very much get away from each other. It's really a very difficult recipe.
You have got some ideas of ways that this could be counteracted. What are they?
I do. I mean, when you have a look at places like France, for example, they're using unsold or unused motel rooms, and there are many of those around, working closely with peak domestic violence organisations. But also in France there is a code work, and the Pharmacy Guild has been enlisted to, if a woman goes into a chemist and uses this code word, then the police are contacted and she can get help. I mean, one of the issues was saying, well, we're going to...
A bit like we have the Angela at bars and nightclubs. You ask if Angela's there.
Yes, I'm not very familiar with that, but I'm hearing what you're saying, and it would be a very similar thing. It's a warning that something is not correct. But the other thing, of course, is the investment in telephony services, which is what the government's talking about, is all well and good. But if you can't, particularly with COVID-19, if you can't get to a phone and speak confidentially, then you're really quite stuck.
Now, we are seeing those hotels and empty motel rooms being used for homeless people, and also for those people who have to self-quarantine after being overseas. You'd like to see a similar system in place for families who need support?
I absolutely would. I think the New South Wales government was... not the New South Wales government, but some NGOs in New South Wales were undertaking to set something up with unused hotel rooms. But it seems to me that this is a very creative way in which the government and the sector could work together to provide a safe place for women and children.
We're seeing issues on the New South Wales-Queensland border where the closures are impacting the smaller roads that connect the two states, very much on Indigenous residents who have no fixed address and living in overcrowded housing. What sort of threat is COVID-19 posing to Aboriginal communities?
The Labor Party Indigenous or First Nations Caucus Committee has been convening for the last 3 or 4 weeks, discussing this, talking to state and territory governments and compatriots, getting briefings from the government, but also working closely at a state and territory level. What you're highlighting, Fiona, is a really serious problem. For First Nations people, there are a number of very serious health issues. We know that Aboriginal people over the age of 50 recommended to self-isolate, but the big issue is the issue that you've identified, and that is overcrowded housing and the impossibility of self-isolation, and in some cases hygiene because of a lack of clean water and available food security.
And the government has released a range of measures to try to cushion the financial impact of the self-isolation measures. But you believe they've forgotten women who may not now be eligible for parental leave?
I'm very worried about this, and I'm very, as is the rest of my party, very pleased to see the job seeker and job keeper payments. I think the job keeper payments has missed out casuals and people on a temporary visa, but it's actually, now this sounds complex and I'll try and make it as simple as I possibly can. I'm worried about the effect of COVID-19 on thousands of families who are eligible for paid parental leave. So the way in which paid parental leave, or the amount that you get, is determined by how many weeks you work prior to the birth of a baby, and if you are put off or let go, and you're coming up for paid parental leave, it may be that you don't qualify because you haven't worked enough hours to actually get the payment. And this could actually mean that some families are $15,000 worse off. And it's a really serious issue. I don't think it's deliberate. I think it's just one of those...
It's the circumstances of what's happening.
And the good thing is, though, is that Anne Ruston, who is the Minister, through an amendment that we were able to get at the last sitting of Parliament, is able to change this without having to come back through a legislative process. And I'm really urging the government to look at this, to think about the circumstances and think about the impact it might have on people eligible for paid parental leave.
Linda Burney, thank you for your time. That's the opposition spokesperson for Families and Social Services.